Hi and welcome to the channel where we talk about medical topics and lifestyle. So imagine in this video that we have a 54-year-old man. 54-year-old man who is inactive, he's gained weight. Picture that this was done during lockdown, so we haven't been moving a lot. We have a history of hypertension, pre-diabetes, a high BMI, Q risk score, and we do take some medication for our blood pressure and cholesterol. And let's imagine this man has never enjoyed exercising and is worried that it might do him more harm than good. So this is a common example that comes across to doctors, and what do we do about it? So most doctors actually are uncomfortable with this kind of a situation because they're uncomfortable discussing the topic because of workload, it's a busy day, and lack of expertise. So in this video, we are talking about exercise and heart disease. So how are we going to motivate this gentleman to exercise? Is it a good idea to exercise? Is it safe to exercise? What are we going to do about all this? The most important thing to take away from this video, if anybody takes anything away, is that it's a modifiable risk factor. So that's the most important thing. What are the benefits of regular exercise? So there are some common known facts about it. Now let's get into a few more details. We're going to dive into a few studies that have been done. So a recent meta-analysis study done, for example, shows that there's an inverse relationship between physical activity and cardiovascular disease mortality. So the more exercise you do, the less our cardiovascular disease mortality becomes. The other studies highlight the effects on other factors such as your blood pressure. So if you do moderate and intense exercise 3 to 5 times per week, it can bring down the average blood pressure by 3.4 and 2.4 in a non-hypertensive and 7/6 by hypertensive. So imagine that, it just brings down that number. We might not need to take medication, for example, as a result. Think about what a huge difference that can make. So just a bit of exercise and you don't need to take medication if you're just borderline hypertensive, for example. So very powerful stuff, exercise, highlighted in some of these studies that we look at here. And it goes beyond just impacting the cardiovascular health, as we'll highlight in a few minutes. So how much exercise should we be doing in a patient who is at high risk and somebody who isn't either? So people with cardiovascular disease or high risk of cardiovascular disease, they should be aiming for at least 150 of moderate to intense aerobic activity or 75 minutes of vigorous intensity or a mixture of the two. And this is very, very important. But on the other hand, it's not just that we need to focus on the aerobic side of things, but also muscle strengthening activities is also very important, especially when we're frail and old. The stronger we are, the better. And to be honest, these guidelines are just guidelines. So I want to highlight that a lot of studies are pointing that even if you're exercising less than the recommended amount, it still gives a substantial cardiovascular health benefit. So there isn't a minimum that you need to hit. As long as you're doing some exercise compared to what you were doing yesterday or last week, you will improve. So that's the greatest motivating factor, actually. Any activity is good activity and can be improved upon, and we can take it from there. So please get moving. There are vast health benefits, as you can see from a lot of these studies being done. What are the contraindications to exercise? Is somebody not allowed to exercise? So just to make it clear, there are very few occasions where you're not allowed to exercise. So there's approximately 1 death per 23 million hours for men, a bit more for women. So very important that we know that it's not that dangerous to exercise. We can always consult with a cardiologist if we're worried, if we have a question. We're going to highlight some very cardiac conditions that we should consider. But again, as long as things are under control, for the most part, we can exercise within our limits and as much as our bodies allow it to happen. As you can see, the vast majority of contraindications, or when we should be considering whether it's okay to exercise or not, is when we have a lot of kind of unstable heart conditions, rhythm disorders, really wild blood pressure, if we had a heart attack, these kinds of things. I think it's quite common sense. And for the most part, people should be exercising and should be doing some sort of physical movement, be it aerobic or strength training. So how can we prescribe exercise? Should we be prescribing exercise? Should the doctor prescribe it, or should you just go and exercise? Well, it's very complex, actually. So when we're seeking the doctor's advice, only 20% of the family medicine or GPs are aware of the guidelines that we mentioned a little while ago, which is crazy. So the first thing is that the health professional needs to educate themselves and be aware. So prescribe the exercise like you would a medication. So review past medical history, review contraindications, review all these things, and communicate appropriately with the individual. So don't just say exercise more, because that's going to provoke answers like, I already exercise every day, or I can't exercise because of my pain, and so on and so forth, circular conversations. Rather, we need to use online resources. So this video, for example, we highlighted a lot of good facts here. We can use questionnaires, such as that one there, to test our baseline physical activity. We can ask open-ended questions. Are you interested in being more physically active? And we should take a more holistic approach, exploring the ideas, the concerns, and the expectations from the individual. And finally, how do we motivate such a person? How do we motivate ourselves? Not just the doctor, but how do we motivate ourselves to exercise? So we can illustrate cardiovascular health as a whole. So this video highlighted some really poignant facts and really useful facts, but we also shouldn't neglect flexibility and strength as well. And then ultimately, how are we getting into the habit of regularly exercising? So you have brilliant resources. Atomic Habits, for example, is a nice novel to read. So there's lots of ways to consult with somebody. There's lots of ways to motivate one another or just oneself. So for example, from this book, you can take a very simple example. When it comes to exercise, you can try to associate a new habit with a positive experience. So changing your perspective, just changing a word in the phrases that you use. So you don't have to do it. You get to do it. So right away, that's a powerful, powerful change that you can incorporate in your everyday routine. So take, for example, the man in the wheelchair. So you ask a man in the wheelchair what he's happy about. He's happy that he's not bedbound. So his mindset is completely different. He is grateful. He is happy. Maybe we should take that approach and say, I'm so happy that I can walk around my neighborhood every day and walk my dog or something like that. I'm so happy that I have legs, for example, and I can walk or run or do whatever. Simple examples, changing our mindset, motivating ourselves. So that's just one of the examples. I recommend reading the book. It's brilliant if you want to start new habits, things like that. I really, really hope you took something away from this video. There's very little things that should be stopping you from exercising. I hope you enjoyed the video. Please like and subscribe for more. Leave a comment in the section below how you motivate yourself to stay healthy, to exercise, and we'll see you in the next video. Take care.